COVID-19 has richly demonstrated the importance of data and very high quality real-time data. In Precision Public Health Asia in April this year, we are bringing together the best practitioners and academics around the world to bring the insights of what we have learned from COVID and other diseases to help us to really make precision public health a reality, not just for the rich world, but for everybody. Healthcare will always be characterized by infinite demand and very finite resources. We have to target resources to where we have the biggest bang for buck. And precision public health, whether in COVID, whether in dengue, whether in diabetes, will allow us to know who needs what at what point in time and hence stretch the very, very limited healthcare dollars.